action.
Hello, today we are going to be discussing nutrition and hydration. My name is Ileana Gonzalez, and Marsha Jennings and Jennifer Jones are also going to be discussing this topic with you today. Nutrition. Proper nutrition means that all the essential nutrients are adequately supplied to maintain health and well-being. About 17% of older adults consume a good diet. It is recommended that you intake 45 to 65% of carbohydrates, 20 to 35% of fats, 10 to 35% of proteins, 1.5 to 2 cups of fruits and vegetables, and 3 servings of dairy products. Malnutrition is defined as a state which deficiency, excess, or imbalance of energy, protein, nutrients, causing adverse effects to the body. 16 to 30% of adults are malnourished or at high risk. This causes anemia, pressure ulcers, hypotension, infections, impaired cognitive, hip fractures, and increased morbidity and mortality. Hydration is the adequate fluid balance which prevents complications. It is recommended to intake 1,500 milliliters per day, unless you're on a food restriction, which would pertain to usually dialysis patients and your CHF patients. You want to avoid drinks with high sugars, such as sodas, energy drinks, which will dehydrate you. You will have symptoms with dehydration such as thirst, dry skin, fatigue, lightheadedness, confusion, increased heart rate, increased respirations, and an electrolyte imbalance. And now I'm going to turn it over to Jennifer.
Hi, my name is Jennifer Jones, and I'm going to talk to you about the nursing interventions involved when caring for elderly patients in regards to their nutrition and hydration status. Prior to implementing any type of intervention, we're going to want to start with an assessment. This assessment is going to include a nutritional screening, which includes a mini nutritional assessment and interview. The mini nutritional assessment is going to be something that the elderly patient is going to fill out on their own. It's going to give them a score. It's going to kind of be indicative of where they are as in regards to like their nutritional needs. The interview, you can learn a lot by interviewing your patient, talking to them about what they eat, the things that they should eat, and kind of get an idea of their nutritional needs as well. We're also going to do a physical examination. During the physical examination, we do want to keep in mind any age-related changes that occur within the body as we age. Keep in mind contributing illnesses that may cause nutritional deficits. One of these that to mention is dementia. Also, you're going to want to keep track of their weight history. Look back in the records and see if they've lost weight over time or if they've began to gain weight. Also, during the assessment phase of this, you're going to want to do a diet history. Many elderly patients are going to forget. They're not going to be able to tell you what they eat. A good way to get around this is to do a 3-day food diary, and this is where they keep track of everything they eat. This way we can have a clear picture of exactly what they're intaking, areas where they may be lacking, and what we can do to help them meet their nutritional needs. You're going to want to assess dysphagia, see if they do suffer from dysphagia, any trouble swallowing. In the same realm of dysphagia, you're going to find PEG tubes. You may have a patient that already has a PEG tube, so you want to make sure that they are getting adequate nutrition and hydration through the PEG tube, or due to dysphagia, you may have a patient that is a candidate for a PEG tube. And lastly, you're going to talk about oral care, assess their oral care, see if they practice good oral care. That's detrimental to an elder patient's health, and it is one of the areas that many elderly patients are lacking in. Once we've assessed the patient, we're going to move on to interventions. First, we're going to utilize techniques to increase food intake. This is going to include serving meals in a chair rather than a bed. In the hospital, we get used to just giving patients their food in a bed, but a patient is actually going to be more apt to eat if they're sitting in a chair. Determine their food preferences. Obviously, people are going to be more willing to eat foods that they enjoy. Make sure that their dentures fit properly. Don't interrupt meals to administer medication. Encourage social relationships during meal times. This may include the family. Have the family sit down so that it's more like a social interaction, so that they can enjoy mealtime. Or if they live in a long-term care facility, find other patients that share the same interests, hobbies, or beliefs, so that they can all sit down and enjoy their meal together, and it becomes more of a social interaction. And then any patients that may need assistance, give assistance when feeding. And then interventions specific to patients with dementia. Only give them one item of food at a time, one dish with one utensil, so that way they don't get confused. Serve soup in a mug to avoid any spilling. Cut up their foods for them. Provide finger foods, they're easier for them to eat. And then you may have to sit with them and provide verbal encouragement so that they don't become distracted and start doing something else. Interventions specific to dysphagia. Make sure to position the patient at 90 degrees while eating throughout the meal. They're going to want to maintain this 90-degree position an hour after the meal. Make sure that they take small bites. They should alternate solid and liquid boluses. Suction equipment should be on hand in case needed to avoid aspiration, and then make sure to supervise meals. And then next we're going to come to teaching strategies that are going to help the elderly in regards to nutrition and hydration. First, we're going to talk about education. When educating an elderly patient, talk about their nutritional requirements, diet modifications due to chronic illnesses, and go over community resources that are available to them to help them. Make sure to include instructions for proper oral care and denture care. And then make sure to let them know that Medicare covers nutrition therapy for chronic illnesses such as diabetes and chronic kidney disease, because these can be really good resources for them out in the community. When teaching, in order to provide an environment that is conducive to teaching, make sure to provide easy to understand instructions. Make sure that nothing's too complicated for them to understand. As we all know, elderly patients can be a bit stubborn, and they don't want to admit if they don't understand, so they're just going to say okay. So we do want to make sure that they understand what we're telling them. Ensure the patient is able to hear properly. As we age, we do suffer from loss of hearing, so make sure that they understand and they hear what we are saying, and they're able to repeat the instructions to us. Reduce any noise in the room or any distractions, and use this educating session as a way to incorporate the family members as well. Include them and family members and caregivers in the educating and teaching. Next, we're going to talk about alternative options, and that's going to be Marcia.
Thank you, Jennifer, and thank you, Ileana. I'm going to be talking about the alternative options for nutrition and hydration in elderly individuals. So, first I want to say, as nurses, whether you've taken a nursing course or a nutritional course, you're aware that, and you've heard the same phrase over and over again, digestion starts in the mouth. Basically, we all know the process of digestion. Basically, we chew our food, it mixes with our saliva to make it easier for us to digest and swallow. It goes and travels down our GI tract where it gets absorbed by the cells to turn into energy and to help build body cells. Unfortunately, for a lot of elderly individuals, this is where the problem starts, in the mouth, in the throat area. These people are unable to swallow, and they have what is called dysphagia. Dysphagia is basically difficulty swallowing. We've all heard of this before, and it's very common in older adults. As a matter of fact, it affects 16 to 22% of adults that are 50 years old or older. As a result, it can cause weight loss, malnutrition, dehydration, aspiration pneumonia, which can also lead to death. It's important when we talk about dysphagia to know that we sort of break this down into three categories. The three categories are neurological, obstructive, and muscular. So when we talk about the neurological status, we're talking about things that basically affect the brain. This is patients with history of stroke, Alzheimer's, Parkinson's, and multiple sclerosis. When we talk about obstructive issues with the throat, we're talking about things that are basically blocking food from being able to pass through the throat. So we're talking about issues that like mouth cancers, throat cancers, and things like that. Now, when we talk about muscular issues, these are just issues that affect the throat muscles and make it hard for the patient to swallow. Some of these issues are myasthenia gravis, scleroderma, and echolalia, and they basically affect all the muscles in the throat. Now, some of the treatments have to basically do with what is the patient's history and how functional is the patient's throat and oral cavity. A lot of times, when you have a new patient and you perform your assessment, it is not always readily apparent that the patient has issue with swallowing. But with some good nursing assessment after meals and things, you can sort of determine by just assessing your patient, does this patient is this patient a candidate for some outside treatment, possibly from a speech therapist. Speech therapist basically is going to let us know what is the best course of action to take to treat this patient or to help this patient with their swallowing issues. A lot of times it is the treatment is basically pretty simple. Sometimes it's like the things that Jennifer was talking about earlier, like supporting the patient at meal times. Sometimes it's what Ileana was talking about earlier, just educating the patient what is the proper nutrition for that patient, and seeing to it that this person with possibly dementia is able to have access to good healthy foods and is reminded, of meal times and to eat with family and eat in social settings. Sometimes it's a little bit more complicated, and it's and requires a altered texture diet, or like thickened meals, thickened liquids, or mechanically soft diet and things like that. And a lot of times it's even more simple. It's just oral care. A lot of times the elderly patients have bridge work done that becomes damaged or becomes old over time. A lot of times elderly individuals might have the bridge work that actually hurts them. And they might also have rotting teeth or cavities. In these instances, it's very important that they see a dentist, probably have those teeth pulled, have some cleanings done. So these are things that are done in acute settings where there is still some function of the throat and oral cavities. Now, as patients, a lot of times if they're seeking end-of-life care, a lot of times those patients are unable to swallow, unable to eat orally. If they have cancer, some kind of obstructive issue going on, they may have to have a feeding tube. It's important that the nurse knows and makes sure that she shares this with her patient and their family, that this is not a option that basically prevents all of the issues that we were talking about earlier with aspiration and things like that. As a matter of fact, it actually can make things worse. It does not improve the quality of life, and it actually increases the patient's risk for aspiration. And as a matter of fact, nearly 50% of patients die within 6 months of having a PEG tube inserted. So it's very important that we understand the patient's desires as well as their family's desires when we're talking about implementing something like a feeding tube, because it's very controversial and there's a lot of legal and ethical issues that go along with this particular intervention. Now, as we're talking about these things, this is basically a recap of what we all talked about today. It's basically the role of the nurse to examine the risks of the patient. When the patient first comes in, you want to triage this patient appropriately. You want to make sure that this patient is, their history. Patient comes in with a history of stroke, comes in with obvious Alzheimer's or dementia, or the patient has some visible trauma to their mouth and their throat area. These would be situations where the nurse would want to make sure a speech therapist is involved, make sure that she pays attention to her a thorough assessment, and make sure that she knows this patient's risk for developing, for having dysphagia. Also, once we've done this thorough assessment and examined the patient appropriately, we want to make sure that we consult the right people and facilitate the appropriate treatment. Not just seeking out a speech therapist, but making sure that the patient is treated appropriately, whether that be teaching the patient some of the things that Jennifer talked about earlier, proper position, chin tucking techniques to help them swallow, making sure that they get their diet on time if they have dementia. Things like that. And also, when we talk about sort of the end-of-life issues that we talked about with the PEG tubes and cancer and things like that, making sure that you are an advocate for the patient, make sure that you have read the chart and are aware of the patient's advance directives. what is the desire of the patient. A lot of times with elderly individuals, they are not just seeking care, but their children or their caregivers are seeking care for them and speaking on their behalf. And a lot of times their desires get sort of mixed up with their caregiver's desires. And a lot of times we as nurses have to act in the best interest of the patient and what they would want. So basically, just that basically concludes our presentation on nutrition and hydration. Thank you for listening.